Do you know that medical imaging plays a crucial role in screening, diagnosis, and managing health conditions during pregnancy? Although pregnancy is a time of joy and anticipation, it can also come with health concerns. You may need to undergo medical imaging at different points during pregnancy. But is imaging safe for both mother and the child during pregnancy? Do you need to avoid imaging at all costs? If not, which imaging modalities are safe and which imaging modalities carry significant risks? If you want answer for these questions, this video is for you. Welcome to Info Radiology. Dr. Raj here, I am a radiologist. From confirming the first signs of life to preparing for delivery, ultrasound is a trusted companion throughout pregnancy. It ensures the safety of both the mother and the baby without use of harmful radiation. Ultrasound uses sound waves instead of radiation to provide real-time images of the fetus. From routine checkups to diagnosis of complications, ultrasound is the most common imaging modality used during pregnancy. Ultrasound is an invaluable tool for monitoring pregnancy at every stage. It offers vital information about baby's health and development. Let's break it down by trimester and understand its uses. In the first trimester, that is from time of conception to 13 weeks of pregnancy, ultrasound is mostly used for early monitoring of pregnancy. Firstly, it helps confirm pregnancy as ultrasound can detect a gestational sac as early as 4 to 5 weeks and confirm a fetal heartbeat by 6 to 7 weeks. Secondly, it helps establish the gestational age and estimated due date for dating pregnancy. And finally, it is used for detecting multiple pregnancies. Moving on to second trimester, which is from 14 weeks of pregnancy to 27 weeks. Ultrasound is useful in monitoring growth and screening fetal anomalies. An anomaly scan, usually done at 18 to 22 weeks, is used to evaluate fetal anatomy and detect congenital anomalies. Regular ultrasound during this trimester tracks the baby's size, weight, and development, ensuring the growth curve is on track, giving information about fetal growth and development. And in the second trimester, it can be useful for looking at placental position and gender determination. For the last trimester, which is from 28 weeks to birth, ultrasound is mainly useful in preparing for delivery by monitoring fetal growth with regular scans, which ensures that the baby is growing well and also detects any growth restrictions. Ultrasound is used to look at the position of the fetus in the uterus to ensure that the baby is in correct position. Other uses during the last trimester includes performing Doppler studies, which measures blood flow in the umbilical cord and the placenta, ensuring adequate oxygen supply for the baby. Ultrasound is also useful in non-obstetrics related health issues during pregnancy, like evaluating abdominal pain, which can be due to gallbladder related disease or conditions like appendicitis. It can be useful to investigate renal conditions, mainly due to complicated urinary tract infections, and also useful to rule out deep vein thrombosis using ultrasound Doppler technique, as pregnant women have a higher risk of developing blood clots or thrombosis. Let's talk about safety of MRI in pregnancy. Magnetic resonance imaging or MRI uses strong magnets and radio waves to create detailed images of the body. MRI is particularly useful for complex cases like examining fetal brain or spinal conditions, or examining mother for emergency conditions during pregnancy. Is there risks associated with MRI? Generally, it is considered safe for both mother and the baby, especially in the second and third trimesters, as it does not use ionizing radiation like X-rays or CT scans. However, there are some potential concerns and precautions to consider. Let's explore in more detail to gain a better understanding. MRI without contrast has no proven teratogenic effects, meaning it causes no harm to the fetus. As there is no ionizing radiation, studies have not shown any harmful effects on the developing fetus when MRI is performed during pregnancy, even in the first trimester. However, first trimester MRIs are avoided unless absolutely necessary, as this is the critical period for organogenesis, which means development of organs of the fetus. Gadolinium-based contrast agents are special intravenous contrast agents given during MRI for better diagnosis. They are typically avoided in pregnancy unless the benefits outweigh the risks. This is because studies suggest gadolinium may cross the placenta and accumulate in fetal tissues, with some association to rare adverse outcomes like stillbirth or inflammatory conditions. How about heating from radiofrequency wave used in the MRI scanner? MRI can cause tissue heating, but modern scanners are designed to minimize this. Pregnant patients are positioned carefully to ensure proper ventilation and avoid overheating. Therefore, although heating is an issue, with modern techniques, it can be minimized. Loud noise from MRI may reach the fetus, particularly in third trimester, but no studies indicate long-term health effect from this exposure. Therefore, MRI is a safe imaging option for pregnant women when used judiciously. It provides critical diagnostic insights while minimizing risks to the fetus. However, decisions about MRI during pregnancy should always involve careful discussion with your healthcare provider. Let's talk about imaging modalities to avoid or use with caution during pregnancy. First, we will talk about X-rays. X-rays involve ionizing radiation, which can pose a risk to developing fetal tissues, especially during the first trimester when organogenesis occurs. The theoretical risks include potential cellular damage or an increased lifetime risk of malignancies. For these reasons, X-rays are generally avoided during pregnancy unless the benefits outweigh the risks. However, in emergency conditions such as trauma or suspected fractures, they may be necessary. To minimize risks, doctors use protective shielding and lowest possible radiation dose. Radiation exposure from a single diagnostic X-ray is typically far below the harmful levels, making it a safe option when used judiciously. However, if not absolutely required, X-rays are best avoided to eliminate even minimal potential risks. Let's move on to CT scans. CT scans, like X-rays, use ionizing radiation but provide more detailed cross-sectional image of the body. They are generally avoided during pregnancy due to increased radiation dose compared to standard X-rays and the potential risks to the developing fetus, including cellular damage and slight increase in risks of childhood cancers. The risk is especially concerning when imaging involves the abdominal or pelvic region. Nevertheless, CT scans may be crucial in life-threatening emergencies, such as evaluating trauma or diagnosing conditions like pulmonary embolism. Protective measures such as shielding and dose minimization are always employed to reduce risks. However, when imaging modality without radiation are feasible, they are preferred. Thanks for joining us today. Please like, share and subscribe for more radiology content.